Welcome back. You know, roughly 31 million Americans suffer from back pain at any given time.
It can be from work, exercise, or simply degeneration over the years.
The good news is that there are options for people who are dealing with a spinal fracture, which is a condition that can result from osteoporosis and often cause back pain.
Dr. Joshua Hirsch from Massachusetts General Hospital and Liz Thompson, who's the CEO of the National Osteoporosis Foundation, actually shared more about what's available.
Good Health is sponsored by Sullivan County Community Hospital.
Back pain is an incredibly common problem, with 80% of the population experiencing it at one point or another in their life. Men and women are equally affected, and there are many causes. Those causes can be temporary, muscle ligament strain. They can come from heavy lifting, awkward movements. But we're here today to talk about vertebral compression fractures from osteoporosis, which is a serious cause of back pain.
And it impacts so many people. In the year 2000, there were 9 million osteoporotic fractures. And of those 9 million fractures, 1.4 were VCFs, or these vertebral compression fractures that happen in the spine. What's important to know is that VCFs will likely only become more prevalent as the population of the United States ages. And what is a public health crisis and absolutely unacceptable is that 2/3 of these patients who have VCFs take months to be diagnosed and move into treatment. That is simply unacceptable. We're so delighted about the work that Dr. Hirsch is doing to really change this for patients.
There's a big move happening in healthcare, like in much of our personal lives, where instead of having blanket approaches to something, we're personalizing treatment. In order to deal with this problem of osteoporotic vertebral compression fractures, they're underdiagnosis, sometimes non-diagnosis. We put together a group of experts from multiple disciplines, used a well-validated method called the RAND UCLA Appropriateness Method, and derived patient-specific pathways that are evidence-based, that help patients get their osteoporosis cared for, their compression fractures cared for, so that they can live their normal lives.